So hello, welcome again to the Wellness Health Services Health Talk. This is our second talk on kidney diseases, and we'll be discussing about chronic kidney failure. Chronic kidney failure is an irreversible loss of the kidney functioning which occurs within a period of 3 months. We have a situation where there is progressive loss of the functioning of the kidneys with the accumulation of creatinine and urea, and the inability of the kidney to regulate the electrolytes in the body, leading to progressive decrease in the glomerular filtration rate. So the main causes of chronic kidney disease are diseases like hypertension, if it is uncontrolled, leading to progressive damage to the vascular vessels to the kidneys. Chronic conditions like diabetes, especially uncontrolled diabetes. Then we also have systemic diseases like lupus, rheumatoid arthritis. You have infections like HIV. We have a chronic use of drugs like NSAIDs, which lead to progressive injury to the kidney tubules, and also some toxins like excessive use of alcohol. There is a progressive accumulation of urea leading to azotemia, which can lead to encephalopathy, and also excessive accumulation of fluid, which can lead to generalized body fluid overload, and also ascites. So the diagnosis is there is progressive loss of the glomerular filtration rate, which is calculated by estimating the urea levels and the creatinine levels, and it is staged into 5 stages. We have stage 1, stage 2, stage 3, stage 4, and stage 5, depending on the loss of the glomerular filtration capacity. The main management of chronic kidney disease is management of the underlying conditions, which include diabetes, ensuring that there is optimal control of the blood sugar and optimal management of diabetes, optimal management of hypertension, and also optimal management of other systemic conditions like lupus, rheumatoid arthritis, and also taking care of patients with these systemic conditions if they have to use NSAIDs. Progressive monitoring of their kidney functioning, so that they do not get to levels that you have kidney toxicity. The other complications that occur due to chronic kidney diseases, the kidneys have various functioning, including the control of body electrolytes and also the body fluids. They also produce erythropoietin, which is a cofactor in the synthesis of red blood cells, and when there is a kidney compromise, then these patients tend to get anemic, and so they need regular replacement of erythropoietin, and they may also have anemia from iron deficiency, so they need iron replacement, and also we may have anemia of chronic disease. So the management of anemia. Then the other complication that they may get is what we call renal osteodystrophy, whereby the kidneys are involved in the control of calcium in the body, and especially vitamin D. Deficiency of vitamin D leads to the stimulation of the parathyroid hormones, which leads to secretion of the parathyroid hormones, which stimulates bone resorptions, and there is progressive loss of bone. So patients with kidney diseases, they need regular replacement of vitamin D, so that we prevent osteoporosis, and also they also need support with exercises, so that their bones are well taken care of. So apart from the management of the diabetes, the hypertension, and the chronic diseases, we also need to make sure that when these patients reach levels that they need renal replacement therapy, then they have timely access to renal replacement therapy, including hemodialysis or peritoneal dialysis, depending on the indications and the availability of services. Of course, with the chronic kidney diseases, then this is an end-stage condition, and at some point they may need kidney transplant. So they need family support, family members who can act as donors, and also support after the transplant, so that they have the access to the necessary medications, access to the necessary health services, so that they are able to live normal lives. So that is it about chronic kidney disease. Thank you for listening to me. We welcome you to subscribe to our health talks from Wellness Health Services. Thank you.